Welcome to the Midwestern Cancer Centre. This DVD is designed to show you what the centre looks like and to explain about chemotherapy and its side effects, including some tips and hints that can help. The Cancer Centre is located at the back of the Midwestern Regional Hospital, Limerick. There is parking available for people who attend our services here. Chemotherapy is a treatment that uses drugs to treat cancer. It can be given to treat the primary tumour, reduce the risk of it coming back, or control the cancer and help relieve symptoms, improving quality of life. The usual drugs used are cytotoxic, that is, they kill both cancer cells and healthy cells. Other drugs, such as antibodies, can be used, which specifically target cancer cells depending on the individual's needs. There are more than 50 different chemotherapy drugs which can be given on their own or in combination. The drugs given depend on your diagnosis, stage, and/or age. Chemotherapy can be given before or after surgery or radiotherapy. In some situations, chemotherapy can be given with radiotherapy. Chemotherapy can be given in many different ways, but most commonly it is given into a vein in tablet form or into the spinal fluid. Most often, chemotherapy is given into a vein by a cannula. It can be given in the day unit, which takes between 3 and 8 hours, or the inpatient ward. If it is difficult to site a cannula or the duration of the treatment indicates it, a central line may be indicated. These include a PICC line, Hickman line, and portocath. If one of these lines is indicated, it will be discussed in more detail by your specialist nurse. All cells, including cancer cells, divide and replicate themselves. Chemotherapy interferes with this process. Drugs travel in the bloodstream and therefore reach cancer cells around the body. The cancer cells take up the chemotherapy drugs from the bloodstream. Chemotherapy also affects normal cells, which lead to side effects such as sore mouth. Normal cells usually repair themselves, but cancer cells do not have that ability and eventually die. Damage to normal cells usually is temporary and disappears over time when treatment is finished. Different drugs work in different ways and can be used in combination because of their different effects. When the drugs are given is carefully planned to maximize the effects of the chemotherapy drugs and minimize the damage to normal tissue and therefore the side effects. If you have decided to have chemotherapy, you will be given an appointment for either the day unit or the inpatient ward, depending on the duration needed to give the chemotherapy drugs to you. Before you start, some tests will be done to ensure that you are well enough for treatment. It is routine to have a CXR, ECG, and blood test done. The blood tests taken check your white cells, red cells, and platelets. The importance of these will be explained later. Your liver and kidney function is also assessed. These blood tests are repeated before each cycle of chemotherapy and usually take about an hour to process. Some drugs will necessitate further tests such as hearing tests, a special urine test, and an ultrasound of your heart. Side effects of chemotherapy drugs occur because the action of chemotherapy is not specific to cancer cells. However, normal cells usually recover after the treatment is finished. If you become unwell in any way while on treatment, it's important to contact your specialist nurse, day unit, or inpatient ward rather than your GP. We aim that you will continue your life as normally as possible while on treatment. Chemotherapy can reduce the number of blood cells produced by the bone marrow. Bone marrow is a spongy material that fills the bones and contains stem cells. From stem cells, you get 3 kinds of blood cells. White blood cells are essential for fighting infection. Red blood cells contain hemoglobin to carry oxygen around the body. Platelets help to clot the blood and prevent bleeding. Chemotherapy drugs can lessen your resistance to infections. This happens because most chemotherapy drugs affect the bone marrow where white blood cells are made. If you don't have enough white cells, even a minor infection such as a cold or a sore throat can make you ill. White blood cells influence your natural ability to fight infection. Therefore, when your white cells are low, usually 7 to 14 days following treatment, you are at a greater risk of infection. This does not mean you cannot continue your normal activities. You must look after yourself though during this time and be alert to the signs and symptoms of infection. These symptoms could be sweating or chills, a burning feeling when you urinate, a severe cough or sore throat, unusual vaginal discharge or itching, redness, swelling or tenderness, especially around a wound, sore, pimple or intravenous catheter, abdominal pain and/or diarrhea. You must contact the day unit or ward 4B rather than your general practitioner if any of the symptoms occur. Also note that occasionally symptoms may be absent and you may feel generally unwell. You must take your temperature, as a fever, high temperature, or hypothermia, low temperature, can represent infection. Do not take paracetamol or other medicines containing paracetamol. Always read the label. Paracetamol falsely reduces your temperature for a few hours, and this delay can lead to a serious infection. Red blood cells carry oxygen around the body. If the level of red blood cells is low, you may feel tired, weak, dizzy, lightheaded, and muscles and joints can ache. Some people will feel breathless. These are all symptoms of anemia. Your blood tests will be routinely checked throughout your treatment to measure your hemoglobin. A blood transfusion can be given if your hemoglobin is low. These extra red blood cells will quickly pick up the oxygen from your lungs and take it around the body, helping you to feel more energetic and less breathless. If the number of platelets in your blood is reduced, you may bruise very easily for no obvious reason. This is because platelets help to make your blood clot and stop any bleeding if you hurt yourself. You may suffer from nosebleeds or bleed more heavily than usual from minor cuts or grazes. It is important that you contact the hospital if you notice that you are bruising more easily or notice any red spots under the skin which can look like a rash. You may need to attend hospital and have a platelet transfusion, which will start to work immediately to prevent bruising and bleeding. Men should use an electric razor during treatment to lessen the risk of bleeding. While having chemotherapy and for some time afterwards, you may feel tired or fatigued. You may also have a general feeling of weakness. This tiredness tends to increase the longer you are on chemotherapy. It will ease off gradually once the chemotherapy finishes. Some people find they feel tired for up to a year after treatment. Some hints and tips that can help combat tiredness are: planning. Keep a note of your energy level. Pace yourself and plan enough rest and sleep periods. Ask for help when you need it. Spread out tasks over the week. Do a little each day rather than a lot in one go. Use a wheeled shopping bag to carry shopping. Sit down to do whatever chores you can. Drink 2 to 3 litres of water daily. Try eating little and often. Try cooking simpler meals. It's important to try a little exercise if you can, as this decreases fatigue. Try a short walk of around 10 minutes and gradually build up to tolerance level. Try not to take long naps during the day. Aim for around half an hour at a time. Go to bed at the same time each night and try to rise at the same time each morning. Get up and dressed in the morning. Avoid stimulants like Coke, coffee, tea late in the evening. Try lavender under the pillow to help sleep. Keep the temperature of the house stable. Relaxation techniques such as listening to tapes, breathing exercises, gentle massage. Complementary therapies. Aromatherapy, reflexology and massage can help and are available during your treatment in the support centre. Some chemotherapy drugs may make you feel sick, nausea, or be sick, vomit. On the other hand, many people have no sickness at all with their chemotherapy. However, for those who do, there are very helpful treatments for sickness. In fact, this is much less of a problem than in the past. You will be given anti-sickness drugs before your chemotherapy and going home following your treatment. If these are not effective, it is important that you contact your specialist nurse, the day ward or the inpatient unit so that more effective treatment can be commenced. Some practical tips that may help if you are having problems with nausea and vomiting are: eat dry food, like plain biscuits, first thing in the morning before you get up. You may need to avoid preparing food. Allow someone to do it for you. Start off by eating light foods and introduce small portions of your favourite foods. Avoid greasy, fried, fatty foods and those with a strong smell. Cold foods may be better tolerated. Sip fizzy drinks like mineral water, ginger water or lemonade through a straw. Fluids are important. Drink between meals rather than with them. Avoid alcohol. Try ginger. Grate it into hot water, let it cool and drink it or add root ginger to food. Do not lie down after eating. Sit up for a while. Take anti-sickness medication as directed. Taste may alter for a number of days after treatment, but will return. The lining of our mouths constantly rejuvenate and repair damaged cells caused by eating, speaking, etc. Factors that affect this process and sometimes lead to inflammation, ulcers and a sore mouth include receiving chemotherapy. Some drugs are more likely to contribute to a sore mouth. If this happens, it is usually about 5 to 10 days after the drugs are given. To help prevent a sore mouth, we recommend that a dental assessment has been performed in the past 6 months. If any dental work is needed, it should be done before starting chemotherapy. Depending on the dental work that has been done, we may need to defer the initial chemotherapy appointment. Here are some tips and hints which may help. Gently clean your teeth or dentures with a soft toothbrush morning, evening and after meals. Use mouthwash, for example dissolving half a teaspoon of sodium bicarbonate of soda or salt in a mug of warm water. Do not use commercial mouthwashes as they contain alcohol which can dry out the lining of your mouth. Try and drink at least 2 litres of fluids a day. This includes water, weak tea and coffee, and soft drinks like apple juice. Acidic drinks like orange and grapefruit juices may cause more irritation. Warm herbal teas may be more soothing. Keep your mouth and food moist. Add gravy and sauces at mealtimes. Avoid hot, spicy foods, neat alcohol, tobacco, salt, and food with a high acid content, as these can cause irritation. Avoid coarse, dry foods, for example crisps and crackers. Eat soft cereals, porridge and yogurt. Soft dishes such as omelettes, soufflés, mousses, and pureed or chopped food. If you get mouth ulcers, contact your specialist nurse, day ward or inpatient ward, as you may need medication to help heal them and clear any infection. Chemotherapy can cause a change in your sense of taste because taste buds have a high rate of cell turnover and are easily damaged by effects of chemotherapy. Food may taste more salty, bitter or metallic. Normal taste will return after treatment is ended. The following may help with taste changes. Eat only the foods you like and avoid those that do not appeal to you. Flavour of food can be enhanced by adding herbs, sugar, lemon, flavoured sauces and seasonings. Try marinating food. Pulses and nuts can sharpen taste. Some patients prefer chilled or frozen foods. Sharp tasting foods such as fresh mint or pineapple are refreshing and leave a pleasant taste in the mouth. Preparing and eating food with plastic utensils may help to reduce bitter flavours. Frozen ginger ale, whiskey and pineapple increase saliva production and taste. Hair loss, also known as alopecia, can occur with some but not all types of chemotherapy. The amount of hair lost will depend on the type of drug or drugs used, the dose given and your individual reaction to the drug. If hair loss occurs, it usually happens within 3 to 4 weeks of the chemotherapy treatment. Underarm, body and pubic hair may be lost as well. Some drugs can also cause loss of your eyelashes and eyebrows. Your hair will start to grow back once the treatment stops. You may experience tingling or sensitivity of your scalp before your hair starts to fall out. This is normal and may last a day or so. Some people having certain types of chemotherapy may be able to prevent hair loss by using a cold cap or scalp cooler. This works by reducing the blood flow to the scalp for a short period and therefore the amount of the drug reaching the scalp. The scalp cooler doesn't work for everyone. Speak to your nurse specialist if you would like to consider this option. It is natural to feel upset at the thought of losing your hair. Don't be afraid to talk to your nurse about your feelings. He or she will help you find ways to cope with your hair loss. They will also supply you with a list of wig specialists and information on headbands or bandanas. If you are a medical card holder, you are entitled to a new wig every 6 months. If you have private health insurance, you may also be covered for the price of a wig. Check with your health insurer. Here are some hints and tips regarding your hair while on treatment. Although your hair may not fall out, it most likely will become weaker. To protect your hair, use a mild shampoo, wash your hair at most about twice a week, use tepid water, not hot, pat your hair dry, don't rub, use a wide-toothed comb or soft brush. Don't be afraid to brush your hair daily, but do it gently, using a soft brush. Use hair bands or ribbons instead of elastic hair ties. Don't plait your hair as this can damage it. Don't use harsh hair products like dyes, gels, sprays or perm lotions. Discuss using vegetable-based colours with your hairdresser. Don't use excessive heat like curling or straightening tongs or a hairdryer. If your scalp gets dry, you can use olive oil or a gentle, non-perfumed moisturiser. Avoid using perfume deodorants if there is hair loss under your arms. Use baby powder instead. What happens when your hair grows back? Your hair will start to grow back a few weeks after you've finished all your treatments. Occasionally it may grow while you are still getting treatments. At first it will be fine, but will thicken after a few months. It may be a different colour or texture. It may grow back curly or straight. Treat it gently for the first few months. Avoid harsh hair products for the first 6 months. Wigs can be worn until your hair has regrown. Chemotherapy drugs affect the lining of your gut. This can lead to constipation or diarrhea. Constipation occurs when the stool becomes hard, dry and difficult to pass, or when bowel movements are so infrequent that you may experience stomach cramps and/or bloated feeling. The following may help prevent or relieve constipation. Make sure you have enough fibre in your diet, for example whole wheat breakfast cereal, Weetabix or muesli, wholemeal bread, fresh fruit and vegetables. Natural remedies for constipation include figs, linseed and prunes. Drink plenty of fluids, either hot or cold, at least 2 litres a day. Gentle, regular exercise will keep your bowels in order. Contact your specialist nurse, day unit or inpatient ward if constipation is not helped by any of these, as a laxative may be required. Diarrhea is an increase in the stool volume and liquidity, resulting in 3 or more movements a day. While you have diarrhea, it is best to cut down on fibre intake, for example fruit and vegetables, beans, spicy foods and wholemeal foods. Drink plenty of fluids to replace fluid lost in diarrhea to prevent dehydration, but avoid alcohol and coffee and reduce the intake of milk and milky foods. Eat small, frequent meals. If diarrhea persists, contact your specialist nurse, day unit or inpatient. There are medications available effective in controlling diarrhea. Following treatment in the day ward or inpatient unit, you may experience varying degrees of fatigue, nausea and discomfort. These will affect your level of sexual interest and ability, as well as your self-esteem, as a result of altered body image. Some people wonder, is it safe to have sex while on chemotherapy? There is no medical reason to stop having sex while on chemotherapy. It is perfectly safe, and the chemotherapy drugs will have no long-term effects on your ability to have and enjoy sex. It is advised that a condom is used for a few days following the chemotherapy, and this is to prevent any possible problems for your partner, such as irritation or rashes. Some cancer treatments, and sometimes the disease itself, can cause infertility, being unable to conceive. Infertility can be temporary or permanent. Some couples do go on to have healthy babies after one or other partner has been treated for cancer. Men can consider sperm banking, and it is advised that you discuss this with your doctor and specialist nurse. There are also some options available for women, and these can be discussed with your doctor and specialist nurse. However, your own health will take priority over fertility issues. Do not presume that you are infertile while on chemotherapy. It is important not to get pregnant while on treatment. It is advised to wait 2 years post-treatment before you consider having children. Your skin can become more sensitive during and after having chemotherapy. You may find your skin is drier than usual or maybe slightly discoloured. Dry and itchy skin can be soothed with a non-perfumed moisturiser. Avoid wet shaving. An electric razor is less likely to cause cuts. Some drugs can cause rashes. If this happens, please contact your doctor or specialist nurse. There is a higher risk of getting sunburnt while receiving treatment and in the first few months after treatment finishes. Ensure to use at least factor 15+, cover up with loose clothing and wear a wide-brimmed hat. It is best to stay out of the sun during the hottest part of the day, 11 a.m. to 3 p.m. Your nails may grow more slowly, become brittle or discoloured and break easily. You may notice white lines or ridges appearing across them. False nails or nail varnish may disguise this. A dietitian is available to discuss any concerns you may have in relation to weight gain or weight loss. It is advised that you do not lose weight while on chemotherapy. If you would like to discuss any issues with the dietitian, inform your nurse specialist or doctor, and an appointment will be arranged. The medical social worker in the hospital can help in many ways. They can provide support and counselling to both you and your family, and can provide advice on benefits, entitlements such as a medical card, and services available when you go home. It is beneficial to meet with the social worker to see if there are any entitlements you are eligible to receive. During treatment with cancer, it can take a long time to come to terms with your emotions. Not only do you have to cope with the knowledge that you have cancer, but also the physical effects of chemotherapy. Both a clinical psychologist and counselling service is provided within the support centre. Counselling takes place when a counsellor and you make an agreement to meet in a private and confidential manner to explore a difficulty or distress in your life. Leaflets are available in the support centre and treatment areas. You can discuss issues with your specialist nurse, who will arrange an appointment for you, or you can self-refer. The support centre provides an open, honest and friendly atmosphere in order to help with your emotional and social needs. It also provides up-to-date research-based information. A range of services are available in the support centre, and you are welcome to use these at any time. Please phone or call into the centre at your own convenience. Complementary therapy is offered to patients. It is aimed at alleviating anxiety, fatigue and stress. These also bring about a deep sense of calm and relaxation. Therapies available are reflexology, massage, Indian head massage, Reiki and paraffin hand wax treatment. The therapies are organised following referral by a consultant or nurse. Learning to Live with Cancer programme. This is a research-based programme of support and education for patients who have been affected by cancer, their relatives and friends. Look good, feel better. This programme is aimed to give helpful tips about how to look good during treatment. This is organised by the Irish Cancer Society in association with the cosmetics industry and is run regularly throughout the year. Support groups. Helping people to live with cancer is one of the most important functions of support groups. Families and friends can all come together to share their experiences and communicate with one another. Both a men and women's support group is available. These groups meet once a month. Informational afternoons. Afternoon sessions on different topics such as diet and welfare entitlements run throughout the year. These will be advertised in the day ward, inpatient unit and support centre. Relaxation classes. Relaxation classes are run throughout the year. They help you to learn relaxation techniques. They run one afternoon a week for 6 to 7 weeks.